Questions 741 to 760. 741. A patient diagnosed with obsessive-compulsive disorder, OCD, continually carries a toothbrush and will brush and floss up to 50 times each day. The healthcare provider understands that the patient's behavior is an attempt to accomplish which of the following? A. Experience pleasure. B. Relieve anxiety. C. Avoid social interaction. D. Promote oral health. The answer is B. Relieve anxiety. 742. Which of the following uses for abdominal examination? A. Percussion inspection. Auscultation. Palpation. B. Auscultation. Percussion. Palpation inspection. C. Inspection. Auscultation. Percussion. Palpation. D. Inspection. Palpation. Auscultation. Percussion. The answer is C. Inspection. Auscultation. Percussion. Palpation. 743. Before sending a client for a CT with contrast dye, what the nurse's most important action? A. Teach about the need for post-procedure hydration. B. Verify that the informed consent is complete. C. Place the side rails of the bed up before transport. D. Check the client's health record for allergies. The answer is D. Check the client's health record for allergies. 744. A head nurse of a coronary care unit delegated the staff a senior nurse in that unit. What initial step must the head nurse implement before? A. Check the hospital policies for delegating tasks. B. Explain the task to the senior nurse. C. Negotiate with the senior nurse. D. Take the signature of the senior nurse. The answer is A. Check the hospital policies for delegating tasks. 745. Patient with cataract was admitted in the ward for cataract surgery. On admission, the patient perceived that surroundings are mere as if her glasses need cleaning. What is the most important nursing problem at the early stage? A. Eye pain. B. Diplopia. C. Blurred vision. D. Light scattering. The answer is C. Blurred vision. 746. Nurse is about to perform venipuncture to initiate intravenous therapy with 0.9% normal saline solution. Before venipuncture, the nurse collects the required supplies and plans to perform certain action. Which of the following actions is the most important? A. Apply a tourniquet below the site of venipuncture. B. Place an arm board at the joint above the venipuncture. C. Apply cool compress over the vein to be used for venipuncture. D. Inspect 0.9% normal saline solution date of expiry. The answer is D. Inspect 0.9% normal saline solution date of expiry. 747. 133 patient is being weaned off from the mechanical ventilator is about to hook the endotracheal tube to oxygen at VO2 of 40. Which of the following oxygen administration device is the best the nurse in this situation? A. Ombo bag. B. Ventura mask. C. Tracheostomy collar. D. TP Spriggs. The answer is D. TP Spriggs. 748. A 4-month-old infant is admitted with diarrhea and vomiting. To prevent the recurrence of diarrhea, the nurse should instruct the mother to do which of the following? A. Frequent hand washing. B. Increase milk intake. C. Increase water intake. D. Change diaper frequently. The answer is A. Frequent hand washing. 749. A patient is transferred to the post-anesthesia care unit, PACU, after surgery with epidural anesthesia. After taking the patient's vital signs, what should the nurse assess next? A. Spinal headache. B. Postoperative pain. C. Bladder distension. D. Ability to move legs. The answer is C. Bladder distension. 750. A post-portative patient in surgical unit most indicative of a developing complication? A. Increasing alertness. B. Weak and rapid pulse. C. Negative Hellman sign. D. Minimal bowel sounds in 4 quadrants. The answer is B. Weak and rapid pulse. 751. A 22-year-old patient is admitted in the male diagnosis of tonsillar abscess. He has high fever along with dysphagia, difficulty in talking, and patient is planned for needle aspiration of the intravenous antibiotic, including penciling. What does nursing problem need attention first? A. An imbalanced nutrient due to inadequate. B. Acute pain related to throat inflammation. C. Impaired swallowing related to dysphagia. D. Hyperthermia related to acute infection. The answer is C. Impaired swallowing related to dysphagia. 752. A nurse received the serum digoxin level result for the patient that day and notes that the result is 2.6 /ml. See lab result, test result normal value. Digoxin, men, 2.60.8 to 2 nanograms per milliliter. Which of following nursing actions is the most important? A. Notify the physician. B. Check previous vital signs of patient. C. Record normal value on nursing note. D. Administer scheduled dose of medication. The answer is A. Notify the physician. 753. All of the following are types of spina bifida except A. Myelomeningocele. B. Hemophilia. C. Meningocele. D. Spina bifida occulta. The answer is B. Hemophilia. 754. In the 12th week of gestation, a client completely expels the products of conception. Because the client is Rh negative, the nurse must A. Administer Rogum within 72 hours. B. Make certain she receives Rogum on her first clinic visit. C. Not give Rogum since it is not the birth of a stillborn. D. Make certain the client does not receive Rogum since the gestation only lasted 12 weeks. The answer is A. Administer Rogum within 72 hours. 755. Which of the following patient can be transferred from emergency unit to inpatient ward? A. Patient with DKA has nausea and vomiting. B. Patient with respiratory distress. C. Patient has operation next day. D. Patient with hematoma on mannitol. The answer is C. Patient has operation next day. 756. A client who is gravida 1, para 0 is admitted in labor. Her cervix is 100% effaced, and she is dilated to 3 centimeters. Her fetus is at +1 station. The nurse is aware that the fetus head is A. Not yet engaged. B. Entering the pelvic inlet. C. Below the ischial spines. D. Visible at the vaginal opening. The answer is C. Below the ischial spines. 757. 30-years-old woman absent her menstruation for 5 months and her menstrual cycle come every 28 days. She controlled her diet and do heavy exercise. This woman condition? A. Pregnancy. B. Primary amenorrhea. C. Secondary amenorrhea. The answer is C. Secondary amenorrhea. 758. A nurse was newly appointed to work in the surgical ward. She was assigned to take care of an obese patient who just had an open laparotomy. Her mentor told her to pay attention to the surgical risks associated with obesity. Which of the following post-operative complications the nurse should consider as a high-risk complication? A. Hunger. B. Gas pain. C. Hemorrhage. D. Impaired wound healing. The answer is C. Hemorrhage. 759. A nurse noticed that the digit probe of the pulse oximeter that is attached to the right forefinger of a patient is not reading. Which of the following is the most appropriate action that the nurse must take at this time? A. Change the location of the pulse oximeter. B. Get a new pulse oximeter sensor probe other than a digit probe. C. Maintain position and check it after 2 hours. D. Assume oxygen saturation is at normal level. The answer is A. Change the location of the pulse oximeter. 760. A nurse has taught a patient with iron deficiency anemia about eating all that are high in iron. Which of the following meal is low in iron? A. Dried beans and brown rice. B. Eggs and whole wheat toast. C. Steak and a salad made with fresh spinach. D. Cheese pizza and pasta with tomato sauce. The answer is D. Cheese pizza and pasta with tomato sauce.